Would you mind helping Dana with a sexual assault victim who just came in?
Of course, sure. As a sexual assault nurse examiner, we do forensic exams, collect evidence, and hand it over to the police if a report is made. We also provide resources.
Checking you for any injuries that need immediate attention. Okay, that's good.
We're gonna get a room.
No medications? No. Okay, Dana will come get you when the room is ready, and I'll be back to finish your exam.
Conscious.
Jackson's just a little tired due to the sedative he was on, an involuntary psych hold.
What? That's not necessary.
Tests look good, but Jackson has reported hearing voices. This could be serious.
Doctor,
There's no fluid in the supraspinatic space.
let me look. Okay, right there.
Looks like a subcapsular hematoma of the spleen.
Must have been a big impact.
AR-15 muzzle velocity is 3,000.
Could heal on its own.
It's planned.
Head and neck will have an OR ready with thoracic stand.
SWAT? Really?
I suck at golf.
You spend time in the Middle East?
More than I would have liked.
I worked in Kabul with Médecins Sans Frontières, and in 2020 at the maternity hospital. I met the most incredible, bravest doctors there.
Vashti Barchi. Tragedy. We should grab a beer sometime, share war stories.
I'd like that.
She seems cool.
The minute I get.
I wasn't coming over for that. Good job in the trauma earlier. What's this?
Daniel Scott, 32, weekend dizzy while washing his car, tacky at 106, BP 90/60, temps too high to register.
We have a cooling room. Sepsis panel, UA, urine drug screen, EKG, and CK.
I don't see any apparent trauma. People's reactive?
Mr. Scott, Daniel, can you talk to me?
137, BP 88/60.
What are you thinking, Dr. Santos?
Heat stroke, but consider sepsis or drugs.
Rectal temp is 104.6.
Okay.
That'll give Dr. Santos a chance to get caught up. Your R2 year can be challenging. You just have to keep grinding. What's your dispo plan for Mr. Scott?
ICU admission.
You should call neurology to consult.
Yeah, done.
Since it was exertional heat illness in a young person, the mortality is low. But non-exertional heat stroke in an elderly person, you need to worry.
I'll put in orders for repeat labs.
Good work in there.
Forgiveness instead of permission.
Hello? Oh, okay. Yes, I will be right there. C-Suite wants to see me upstairs.
Ooh, call to the principal's office on your first day, not a good sign.
And have your attention, everyone. The internal disaster at Westbridge has been identified as a cyber has been hit as well. Their ambulances are being diverted over to St. Mary's, but we can expect more walk-ins, and Westbridge T believes we're still vulnerable. So we're going to preemptively shut down all the computer systems. Patient registration, electronic health records, lab and radiology interfaces, email, internet.
Talk to me first. You want to consult my department?
I consulted your fellow attending.
When are we going down? Next time, maybe inform the department chair before the shit hits the fan.
I was on my way to tell you.
I'll make sure you get everything you need.
Okay, let's do this.
IT called me up because I've trained in cyber attack prevention and response.
You can tell everybody what to do.
No, thank you. Best if it comes from the department chair.
Oh, you think?
Everything down to give them time to bolster our cyber defenses.
I believe the question was for how long?
Hard to say. Could be up to 24 hours.
More than a little.
I can remember all of it.
All of what?
Names, doctors, room numbers. I kind of have a photographic memory.
Seriously, the whole board?
Central 12, Harlow Graham.
It'll be abbreviated, so HA for headache, AP for abdominal pain, and so forth.
Central 10, Jackson Davis.
For physical exam, check mark normals on the left and circle any abnormal findings on the right. Questions?
Is your generative AI program still going to be working?
Not for a while. And ditch your SpectraLink phones. There's your voice over internet. Yeah, remarkable, really.
Dr. Al, Robbie's asking for you.
Okay. In trauma if you need me, princess. Got it.
What medication do you take?
Lisinopril and metformin.
Ozempic, Wegovy.
No, kind of expensive.
I'm going to squirt some numbing gel in your nose. If it drips back in your throat, that's okay.
Here, in case hour of sudden painless vision loss in the left eye, no history of hypercoagulable state or vascular disease. Could you look straight ahead, please?
Could be a central retinal artery occlusion.
In English, please? A little blood clot can block the artery at the back of the eye and decrease your vision.
Sometimes it's called an eye stroke.
Stroke? Like she could be paralyzed?
No, this would be limited to the eye.
Is it permanent? First, we have to make the diagnosis. Retinal exam?
Hard to get a good look.
We need the FOP. Massage 10 seconds on, 5 seconds off. Order non-contrast head CT.
Dr. Al-Hashimi, can I present?
Yes.
32-year-old deaf woman with myofascial headache, ibuprofen caused gastritis, and epigastric pain, and she vasovagaled. But now pain-free after Mylanta and a trigger point injection.
Excellent. That can take care of the pain for several months.
Yeah, it shouldn't recur if she keeps her screen at eye level. There is
Central 13 to the front of the CT line.
What do you got?
Sudden onset blindness patient has central retinal artery occlusion. I just spoke to an ophthalmologist at the VA, principal investigator for thrombolytics in cases like this.
Not exactly standard of care, kind of risky.
We'll do informed consent. It's our best shot at saving some of her vision.
Your patient, your call. In 1439.
feeling anything?
We're going to move you to another room for better monitoring. Dr. King, I'd like you to stay with her.
Why?
In case there are complications. You'll be there to respond quickly to a blown pupil, a seizure, altered mental status.
Or I could catch up on my charts. And my deposition's coming up.
Think of this as a great way to steal some quiet time and get mentally prepared. Jesse, Mel's with you.
Who is clearly over a month old and looks amazing. Every marker is normal. She has the cold virus.
Infants with rhinovirus can still have a serious bacterial infection.
Not this one. We send kids like this home all the time.
Except this.
It's standard care these days.
Have your attending give me a call.
Will do.
I can't. So what's the point of New Jersey?
Yeah, good question. Which fellowship?
I've narrowed it down to ultrasound, toxicology, and sports medicine.
Those are very disparate fields leading to very different careers.
I know. I'm a little undecided.
Do you have research experience?
I was a part of a study on racial disparities in healthcare until the White House cut the funding last year.
Yeah, you are not alone. Have you considered a geriatrics fellowship?
I have not.
I've seen your skills with the elderly, and there are a lot of openings. It might be your best shot. Think about it.
Close back, but nothing on plain films.
That's probably because they're all sitting on the portable machine, not getting to radiology. I'll take care of this.
Really putting me to work.
It's been a very busy day, Dr. Barker.
Call me Nick.
What's all this?
I brought radiology to us. Dr. Barker, Nick, will have wet read results for us in no time.
Good idea.
Thank you.
Wet read?
Up to psych. Eye stroke is now in the ICU, and the tongue laceration in South 15 is sobering up before we discharge. It's better be soon, because we need the room.
Okay, I'll grab a med student and get more patients moving out.
Are you not phased by any of this chaos? What a fucking mess. Jesus Christ, we need...
Red phones are for emergencies only. This is a hospital, for God's sake.
Call you back.
Got a gun band?
I like her. More than me?
Only time will tell.
Who's the joker that did this?